Hi, everyone, and welcome to Mondays with Mad. I want to apologize for the inconvenience that happened last weekend. As you know, broadband is one of the things that's on my platform, and this is exactly why. We don't have good cell service or computer service, or we don't even have broadband in our smaller communities, in our rural communities, and that's something that we need to fix. And one of the things that's keeping our economy down. And today we're not focusing on broadband. However, today we're focusing on healthcare. And so I want to talk a little bit about healthcare today. And I also want to tell you that we have a lot of exciting things coming up. We've been working on getting our offices together, and we're just so much happening as we're moving towards this primary election that's coming up in June. So let's talk about healthcare. It's a really important topic. It's really near and dear to my heart. I know that a lot of people in our communities consider themselves to be pre-existing conditions, and people say it that way. And the reason they say it that way is because they have healthcare issues that, if they have to move from one healthcare plan to another, historically has put them on this list that says that they don't get new healthcare, because they have a pre-existing condition or something that's following them through their life. And the reason this is near and dear to my heart, my mother is in a wheelchair and is a polio survivor. My father has gone through quadruple bypass surgery and has knee replacements. All of these things are pre-existing conditions. I myself am a cancer survivor. I'm one of what you would call a downwinder, although not from the downwinders that we're here in Socorro County and through our area, but someone who suffered because of the effects of radiation. And so these things are very near and dear to my heart. The idea of having health care that doesn't preclude people because of chronic conditions that they suffer throughout their lives. Chronic conditions are chronic, and that should not preclude them from getting health care. So health care, to me, is just so important. And what we're looking at right now today, we're looking at threats to our healthcare system that are coming directly from Washington, and not just from the president, but from the Senate and from the House of Representatives, and from the other side of the aisle. What this does is that it has created unstable insurance markets, and it's created rising costs in premiums and in the cost of care. And this is not Obamacare or the Affordable Care Act. It's not from a failure in that. It is from these attacks. And any program that a government puts together and that a government oversees, or even a private corporation oversees, there are going to be problems. And those problems need to be identified and fixed. You don't throw away into the proverbial baby with the bathwater. You just don't do that. So we're looking at these problems that we're seeing. It's really important when you go into that primary ballot and you choose who you're going to be voting for in the fall on our ticket. It's important for you to choose someone who has this standing and that cares about your health care as much as they care about their own health care, because our health care is the same. Steve Pierce, our congressperson right now, he voted to take away health care coverage from 22 million Americans. And it's just this year. And he also voted for a budget that takes over $1 trillion away from our health care. And that is not acceptable. This sort of behavior, this sort of vote, causes people to die. It causes people to die. And we can't beat around that bush. It causes people to die. And that is not acceptable to me, and it shouldn't be acceptable to anybody when they're voting. We need to have quality and affordable health care. It's important. It is, I venture to say that it is a right what I mean now is when we moving forward is that we need to preserve the Affordable Care Act while we're moving towards universal health care. This means, yes, Medicare, expanding Medicare. Medicare is a successful program. Anybody who tries to tell you different is wrong. Medicare is successful. Of course it has problems. Every government program has problems, and those problems need to be addressed. And that's something that we can do, and that I will relish doing when I get to Washington, D.C. We can't privatize our medical coverage further, certainly not our insurance. This is a plan that just takes us back to what was a failed system or non-system that we had before we had the Affordable Care Act. And at the time that we got the Affordable Care Act, we had a bipartisan push towards getting something new. We don't have the original plan, but we can do this again. We can get together and in a bipartisan manner move towards universal health care. What we can't go back to is the corporate greed that we had to break free from, and the corporate greed that excludes people for those pre-existing conditions that I was talking about earlier. One of the most important things that so many people asked about is how we control costs, the costs of our medical care. What we are seeing right now, particularly because of those attacks against our healthcare system, are excessive premium increases, and that is something that so many people are talking about. Here in New Mexico, the average household income is $43,000, and that is from two people working, both parents working. And for a family of four, you can see that the cost of premiums plus the cost of your premium plus your copay, and then plus your deductible, assuming you have to use it this year, that can be half of your income. If it's a catastrophic problem, it can be all or more than your income. And this is just this astounding thing that we need to take control of. Prescription drug costs are also out of control. And right now, we are not allowed to negotiate our drug prices by mandate. We're not allowed to do that. And we need to have that. There's no reason that drug prices, drug costs are not negotiated. My husband and I are on TRICARE, and that is because he is a retired military officer. And so one of the things about TRICARE, this military medical thing, is that the drug costs are negotiated. And so where somebody might be paying $2,000 for a shot, for instance, like when I was going through my cancer treatments, $2,000 for a shot, and I would get that shot, several times a year. And for me, that shot cost me $5. For somebody who's not on a good program, you're talking still to $2,000. And look at the family of four that has $43,000 income. How do you pay for that? You can't. And what we see are a lot of people who have gone bankrupt because of medical care. And that is not acceptable. It just isn't acceptable. We also have a problem in our rural and smaller communities that we are underserved by medical care. And what we need to do is see public health services in more of these areas that are underserved. And with the expanded Medicare, with our universal health care, that would be just part of the program. We need to see preventative care for this, especially for those who are in long-term health care. In this way, we can cut back on the use of our emergency rooms because people are being seen. Think about what happens for well baby checkups. We take our babies every 6 months or once a year, and we catch problems before they become a real problem, and hopefully take care of them when there's small problems. And we need to do that across the board for all people. You need to have a yearly checkup. And that way we're catching things while it's not a terrible thing. We also have our addiction services that have been cut. Mental health has been cut, as so many of us know here in our state. Our governor had cut that. And we need to see those things brought back into all of our communities, not just rural communities. And we need to combat the opioid epidemic and other addictions. And those things fall under mental health. And just mental health care in our state is underfunded and it is underserved. We also need to increase, and this is something we can do at the federal level, we need to increase funding for medical and public health research. We need to, in our state, we need to look into more research into the effects of the nuclear research that we've done in our state, and mining consequences. Again, from mining we've done in our state. We have a tragic population, the downwinders, who don't live too far from my own community here in Socorro, and many of them do live here. And what happened is the first atomic blast, the atomic test, happened here in New Mexico, and this population has been ignored as far as continuing to study and continuing to make sure that these people have health care treatment, as it is appearing that generations down are still suffering the effects of that atomic blast. We also have a tragedy in the uranium mines that we here in New Mexico have uranium mines, and if you go into Cibola County and go spend some time with some of the elderly people who mined in those uranium mines, and when you're talking about this Native American population, I spent some time with a man who told me about his experiences, and he mined wearing just his normal clothes. And as they're mining, walking around in the uranium tainted area, the management would come wearing full suits and oxygen and the whole thing. And here they are mining and breathing this stuff in. And they need to be remembered and through studies. And we also have the uranium plume that comes from, again, Cibola and coming down towards the Rio Grande. And those things need to be studied. And that's something that we can bring into our federal monies into our state. Another area that a lot of people have asked about is healthcare jobs. So if there is a medical center in your community, particularly as a hospital or a larger clinic, those healthcare jobs are an economic boon for your community, and bringing more of these into more communities will also then boost those communities' economy as we build a new center. And so we cannot allow the centers that we already have to close, and we do need to focus on bringing in more of those. So we're talking about putting more facilities into rural communities and onto tribal lands. We need trauma centers. We have a big lack of that, and as you see, so many people, from Socorro have to be flight for life out and to go up to Albuquerque for treatment. And we need more of these in our own areas. We need healthcare job training. We need to expand our home healthcare workforce so that our seniors and our disabled people who are living from daily needing access to good healthcare, they'll have access to quality, often long-term healthcare and support services. One of the ways that I would like to see this done in order to bring more people into our areas, into these communities, is through student loan repayment assistance for those people who choose to practice in our rural communities. I am also a strong supporter of the Conrad State 30 and Physician Access Act, which allows international doctors who come here to study to stay in the United States after they complete their residency programs, as long as they remain and serve in a rural, underserved community. That is that is southern New Mexico, almost across the board. And I will oppose any bans, immigration bans or visa restrictions that jeopardize this state, New Mexico's ability to attract quality medical professionals. So I had a couple of questions. So Angie, and again, these are we sifted through and found several that and put them together. But Angie in Hatch, she asks, how do you get better medical professionals in our small towns? And she noted that we have a lack of that. So I did some digging and I found that excuse me, we're short by about 300 doctors. We are short 3,200 nurses, and we are short 1,600 PAs. And I would like to see in this state not just bringing in new professionals through the loan repayment assistance that I was talking about, but I would like to help nurses move from their nursing practices, the ones that want to move from nursing into being PAs. I would like to help them do that. And I would like to help nurses who want to become nurse practitioners do that. And again, through loan repayment assistance. And that is something that can happen, absolutely can happen at the federal level. And so what we would do then is send people into our rural communities and pay them for their education. I have another question from David in Hobbs, and he asks, drug addiction is a psychological problem. What can we do for addicts? So thank you again, David. I love these questions, and thank you, everybody. I'd like to just keep having them come my way. And I would ask David and any of you who are interested in this to go back to the last program that we had and look at the law enforcement, because we did talk about the opioid epidemic there, but we also need to talk about this under health, because mental health is a crisis in our state. It is a crisis in our state. We need to have halfway houses. We need to have treatment facilities. We need to have training. We need to talk about the idea that as people have been incarcerated, we need to help them get out of that situation, and through healthcare, through mental health, through training, learn how to move away from addiction. And one of the things that we need to think about is that in our state, we will send somebody for 2 months to mental health or to a residency program when they are trying to become clean. And mental health professionals, opioid professionals will tell us, and have told me, that it takes 2 years. 2 years. And we need to talk about that, and we need to make that happen in this state, so that our family, our friends, our neighbors are not so easily returned back to the streets, where they just are going to become addicted again or remain addicted. We need to have meth centers. We need to have opiate centers. We do know that opiate addiction drops from legalized medical marijuana. And I absolutely support legalizing medical marijuana, because I've seen this work for people that I know, veterans who are suffering from PTSD, and it works. It works. And I would also like to see medical marijuana removed from being a Schedule I drug, and so that it can be tested appropriately, so that we know what we can do with it. And anyway, I think that's where we've got. That's the last question. I want to. Next week, we'll go back to our 6 p.m. Monday. We're going to be talking about veterans issues. We also have some exciting things coming up. We're going to have our Las Cruces office opening. The official opening will be Saturday, April 14th at 11 a.m. to 2 p.m. It's located at 755 South Tell Shore, Building C, the downstairs unit, and it's across from the mall. So if anybody wants to come on down there and join us and just be part of this grassroots movement, then I really welcome you. And again, keep those questions coming. Send them to Mondays at MAD4NM, Monday at MAD4NM. And I'll be glad to talk to any of you. Thank you.